Chest pain is one of a few medical complaints that nearly always require emergency care. So let's find out why from an ER doctor. Joining us is Dr. Robert Cox, Medical Director of the Coliseum Emergency Department. Welcome, Dr. Cox. So good to have you.
Thank you. It's an honor to be here.
Thanks. Listen, before we get started, why don't you tell our viewers just a little bit about your medical training and background, how long you've been here, what you did before you joined us at Coliseum.
Well, I trained in emergency medicine at Emory University.
Okay.
And after training, I went to teach at the University of South Alabama.
Wow.
And did academic medicine for 5 years.
Okay.
And for the past 7 years, I've been here in Georgia doing private practice emergency medicine.
Good. And so do you cover Northside and Coliseum campuses?
Yes, our group covers both
Very
Woodside
good.
and Coliseum.
Very good. Well, we're glad to have you. Well, as you know, we said in our introduction, chest pain is always an emergency because it could be very serious. And it really does take equipment and a professional to distinguish why. So before we go into why, I want you to describe to our viewers what are the signs and symptoms of a heart attack.
Well, the signs and symptoms of a heart attack that we read about in medical school are pressure or burning or fullness in the chest that may radiate or may feel like it's coming from the neck or the arms or the back. It may be associated with nausea, shortness of breath, and sweaty skin. And those are the symptoms we talked about in medical school. And more recently we found that in the elderly and in people with diabetes, their symptoms may be something simple like extreme fatigue,
Right.
or nausea or shortness of breath.
Something that's not quite so noticeable, but
Correct.
maybe lingering. Well, why is it so important to call an ambulance instead of just driving yourself or having somebody drive you?
But we feel it's important to dial 911 and call the ambulance so that the paramedics can start life-saving care there at the scene. They're trained to recognize signs and symptoms of a heart attack, start an IV, administer oxygen, administer an aspirin, and do a 12-lead electrocardiogram there at the scene.
And so you should never wait until you get a doctor's appointment when those types of symptoms present.
No, man, we have a saying that's time is muscle.
I love that saying. I just learned it researching for this show. Explain time is muscle.
Well, it's a slogan we use to motivate patients and staff that for every minute the heart is without oxygen, cells die.
And explain a little bit further about the anatomy of a heart being a muscle itself.
Absolutely. The heart is made of muscle. It's cardiac muscle, and it's supplied by coronary arteries. Those are the arteries that supply the oxygen and blood to the heart muscle. A heart attack is basically a blockage in one of those arteries that causes death of that muscle.
Okay, let's go to the ER scenario where your expertise is. When a patient presents to the ER, what's the first thing they do?
But typically when the patient presents and says they have chest pain, the triage nurse will be the initial nurse that greets the patient. He or she will recognize those signs and symptoms and initiate an EKG, a 12-lead EKG we talked about. That's our first test that we use to make decisions about this chest pain
Do they
patient.
bypass some of the other ordinary triage things like taking a temperature? If
They do, because we consider chest pain very serious, and our goal is to get that EKG within 5 to 10 minutes of arrival.
There's got to be a standard protocol for treatment of this, whether it be, I don't know, oxygen, like you said,
Yes,
the
ma'am.
EKG. Can you sort of
There
delineate
is,
that?
and we follow the guidelines of the American College of Cardiology and the American College of Emergency Physicians on how to treat chest pain patients. When the patient arrives, they'll receive the EKG, like I said. They'll also get an IV, they'll get oxygen, and we'll administer an aspirin. And depending on what that 12-lead EKG shows, they may actually go right to the catheterization
Wow.
level.
So that's the advantage of having a cardiac center at an ER. There's just a seamless continuum. They can go from the ER straight down the hallway to the cath
That's
lab if
exactly
necessary.
right.
You know, it is important to always come to the ER with chest pain because it could be very, very serious. But just out of curiosity, what % turn out not to be? And if it's not an MI or cardiac arrest, what might it be instead if it's chest pain?
Well, we certainly see a lot of patients with chest pain because we encourage people to come get checked. And most of the time, it's not the MI, thank goodness.
And what else might it be?
Well, it could be something simple like reflux, where acid has
Sure.
come up into the esophagus and caused some burning. It could be lung problems, gallbladder, pancreas, lots of different
Yeah.
things.
If it is truly a heart attack, are they always admitted pretty much?
Yes, ma'am. The basic therapy
Right.
for myocardial infarction or heart attack is inpatient therapy, or they'll stay in the hospital.
Right. They'll probably go to the ICU or the cath lab.
Correct.
Right. Okay. And after that, you pretty much, as an ER physician, transfer them over to the care of a cardiologist, and
Exactly.
your part is done.
Yes, ma'am.
Let me ask you one more thing. When an ambulance picks up a chest pain patient, what is the communication between the ambulance and the hospital ER? Is it sort of get ready, set, go
It
kind of
is.
thing?
They can recognize those signs and symptoms, and when they give their radio report to us that they're coming in, they can alert us to the patient's symptoms.
So you're mobilized before they even arrive, basically?
Yes, ma'am.
And you start adjusting your other patient load to get ready?
That's correct.
Good. Well, that's great to know. Dr. Cox, thank you so much.